So this is our distinguished guest, Catharine Janssen. She's a retired critical care nurse, a registered nurse, and a breast cancer survivor, so she's been through it. And she's also a Rotarian and a Toastmaster. And I don't know if it's a distinguished Toastmaster is more than a Toastmaster, but she's a distinguished Toastmaster. And she's also a certified cancer coach. And this is what she does, as she spreads the good message that we have to give to people, breast cancer or any cancer. So with that, if I missed anything, I'm sorry. This is what I have written. You can add more to it if you like. And that, Kathy Janssen.
Thank you very much, Carl. I'm just going to bring up my presentation, okay?
Sure. Sorry about that.
Thank you for allowing me to speak tonight on immunology and the impact of stress. I really enjoy immunology in relation to what we call psychoneuroimmunology. And tonight I'm going to speak specifically in relation to our triad that I have come up with. And that is one that is biomechanical, biomedical, and psychosocial aspects of how our central nervous system works in relation to body, mind, and spirit. In particular, I want to speak to the sympathetic nervous system. That's the autonomic nervous system and the sympathetic side, which is the stress side of that scale that raises up all of that stress, and then how your body, in utilizing homeostasis, can bring down that stress with a parasympathetic response through relaxation and rest. Let's start with what is the autonomic nervous system and how is stress even managed in our body. Most certainly, the sympathetic nervous system, what we have been taught is the triple F response, which is fright, flight, fight. And what's really happening in our body when we have that kind of a response? Now, notice when we have a stress response can be psychological, it can be physical, it can be controlled, uncontrolled. There are many manifestations of stress. Also, many people, different people respond to stress in different ways. So what can we do about stress? I will be handling today as well. But let's talk about that stress response. When you have that stress response, the first thing you have is that huge cascade of hormones, starting with cortisol. And that really is the crux of many things because it causes some vasoconstriction and then also response of the epinephrine and norepinephrine response that's going to increase your heart rate and relax your respiratory muscles so you can breathe better, your heart rate goes up, but also that cortisol response actually decreases your insulin level because you need sugar available so that you can exit stage left. So we have to look at what kind of things are happening when we have a stress response. It's not just your heart rate and your muscles and the cortisol and all those feedback loops. It's also what's happening physiologically in your body. How is it affecting our digestive system? And I'm also going to be talking about when we then have the parasympathetic system kicking in and the relaxation response, how things go back to normal and how we set that homeostasis in our body and how important that maintenance of homeostasis is crucial in wellness and how all of the stress responses, whether acute or chronic, affects how our body functions. It also affects us psychologically as well. Stress can affect our organ systems in many, many, many ways. For example, it affects the central nervous system, our endocrine system, our immune system, our digestive system, respiratory, our cardiovascular system, everything. Every system is affected. The autonomic nervous system is responsible for digestion, metabolism, urination, blood pressure, sexual responses, your body temperature, your breathing rate, even your fluid balance. So when you are under a lot of stress, all of these systems are impacted in so many ways. When I look at the relaxation system, that's the parasympathetic nervous system, think of that as the parent. What does the parent tell you? Relax, rest, repair, recover. And psychologically, when you even reframe some of your thinking or your thoughts, that too can help decrease stress. So teaching yourself how to manage stress is just as important as the physiological response of how your body is responding to stress when it occurs. So let's look at the sympathetic nervous system. That is the stress response. When you have a sympathetic system stimulated due to stress, you have your saliva that is decreased. You increase your heart rate. Your respiratory muscles are relaxed so you can take in better air. But you also have the inhibit of your digestive system. And that is really critical in many, many ways, because our physiological body, when we are constantly exposed to chronic stress, it is impacted in how our body functions and how we're absorbing food and how we're even looking at vitamins and our immune system. A fair amount of all the hormones and things that are going on are abdominal related and lymphatic. And lymphatics are significantly impacted on how we manage that stress. I like to think back to when I was in nursing back in the 70s. And back then, cancer was 1 in 12. And through the years, it's gone down to 10, 1 in 10, and 1 in 8. Now it's 1 in 5. Well, what is the difference between back then in the 70s and now in the 2010, 2020s and beyond? And I still say to this day that there are two core things that are happening. Number one, food, our healthy food choices, and how we're handling stress. When we're not eating properly and we're stressed, we already know with stress that you have a decrease of all the gastric juices, decreased gastric motility. So of course you're not going to have the proper absorption of your vitamin nutrients. So that's going to impact when you're not eating a healthy diet. We also need to look at the role of our hormones and how they are affecting all of our sympathetic and parasympathetic systems. Now with that parasympathetic system, that is your relaxation response. These are all the protective mechanisms that reset after stress. And what's important here is we need to understand how do we tap in to our body responses to lower stress. What can we do to make a difference? Let's start with what happens when we do have stress. We know we have that cascade response. We know that cortisol prepares our body for that fight or flight. We know that cortisol inhibits the insulin response so that you can have that sugar so that you can move and activate and respond to stress. But we do have the ability to then reset and correct the balance in that scale with our parasympathetic nervous system. And what are some of the things that we can do that are going to make a difference? How can we reduce that stress? Well, through our happy hormones. Remember I was saying that a few minutes ago that the difference from the 70s to now, and I think when it comes to stress and to what we're eating, back in the 70s, I remember my mom was home all the time and she was cooking good meals and stress was well managed in the family. Where now, oh my God, the whole family dynamics are thrown out the window. We're constant state of stress. We're running all our kids to different events all over the place. And in order to compensate for that, what are we doing? We're taking them to McDonald's or Wendy's or wherever we go. So we're not feeding them healthy meals. And responsibly, we're not de-stressing. And it seems to me we are, the more we have automation in our lives, the more we seem stressed. Let's take it. How can our hormones and how can we influence change so that we can decrease that stress? Let's take a look at dopamine. Dopamine is that chemical of reward. It is a neurotransmitter made in the brain, and basically it works with the neurons, and it is stimulated by food, sex, shopping, chocolate, a little bit of wine, whatever it is that you like doing. These are the hormones, the dopamine that you're totally into. Like, ladies, we've got this under control. What's the one thing we love doing? Getting in the bathtub, having that water so scalding hot the guys won't even join us, and we got a glass of wine, and let me tell you, and some incense going, we know how to relax. We know how to activate that dopamine response. And also, let's look at the endorphins. What kind of things can we do to stimulate that endorphin response? Exercise, absolutely. What is endorphins? They are endogenous morphine. And endogenous morphine is actually morphine that our own body produces naturally. It is an opiate reliever, and it is the opiates themselves that give you that feeling of pleasure and well-being, and it also reduces pain. But it is the endorphins that you get when you exercise. And sometimes some of the hardest things we can do, especially when we are experiencing stress, or for those of us who have cancer, how can we try to exercise just a little bit to try to start to get those happy hormones going? And most certainly a walk. If you can go for a short walk and just start getting some of those endorphins working. Also, laughter. I remember one of the days I went to a Phyllis Diller presentation years ago, and I had laughed so hard the next day that my abdomen was killing me. And they've also been doing a lot of studies with laughter and cancer. And what they're finding is that when people laugh all the time and are happy and have those good, happy feelings, it reduces stress, and it's actually helping with their cancer. And it's actually decreasing the size of the cancer. Now, I find that rather interesting, don't you? So maybe we should take a note there and start watching more funny movies and not all the war and guts and stuff that's going on. So happy hormones and laughter are really important. But another thing that's really nice with endorphins is doing things that you enjoy, like reading and listening to music, walking on the beach. These are the things that help us to just relax, and calm our nerves. Oxytocin, well, that's the mood hormone. Just by socializing, petting animals, physical touch, your partner, helping others, just helping others. You know, I really find that as a Rotarian, I always feel so good when I'm out making a difference in my community. This is the kind of thing that when you're tapping into those happy hormones, it helps to heal. For me, it's giving back as a cancer coach and making a difference as I go and educate women, because I believe that knowledge is power and that you need to educate to advocate for your care. And these are some of the things that as we grow and as we move along in our process, in our journey in cancer, that we can find one more way to tap in to make ourselves happy. What can we do to increase oxytocin, dopamine, endorphins? Well, even serotonin, because serotonin is critical in so many of our body functions. It regulates anxiety, it helps with healing wounds, with nausea, it helps control our sleep-wake cycles, and this actually has a key role in bone health. It is critical with our mood stabilizers and our managing our anxiety. But how do you get serotonin? Well, sun exposure, mindfulness, nature walks. But we also know that serotonin can actually be managed in our own digestive system by eating many things like nuts, and there are many other things. But mostly look at food and serotonin. Search it out yourself. What kind of things do you like where you can fit serotonin in and help the lymphatic system in managing all of these hormones, because they all have effect as neurotransmitters or chemical messengers in our body. And it's these chemical messengers that are helping to decrease stress so that that stress response when it's chronic has less impact on everything that we're doing. Let's go back to that digestive system again. Because when we're not eating properly and we're not absorbing all those chemicals and all those nutrients and all that good food we're eating, how can we possibly make a difference in our lives without having to face and look at making adaptive changes as we move on our cancer journey? One of the first things we have to look at is healthy food choices. We have to look at exercise. We have to look at being happy with ourselves. We have to look at decreasing stress, because we know that 80% of the problems with cancer is stress and food-related problems. These are health-related issues that we can control. It's a matter of taking the time and making the choice, making decisions, just like you make a decision to love. We have to make a decision, that decision, to change for the better. What can we do to move ourselves forward in everything we do? Because those happy hormones are going to shape how we see ourselves, how we feel about our cancer, our bodies. Our immune system is actually quite important in relation to, first of all, we have the lymphatics, and the lymphatic system operates osmotically outside of our circulatory system. But what is involved is that you have all the lymph nodes, like up to 800 lymph nodes in our system, and most of them are in from the shoulders through to the groin, most being in our abdomen. It is important. Our immune system, this is where our T cells, our macrophages, our killer cells, this is how we fight infection and viruses. This is how our body detects cancer cells. It knows that, hey, you don't belong here. It helps us to fight. When we can have a good, balanced nutrition system, when we can have decreased stress, we can bring balance in our lives so that our immune system can fully function. One thing we do know is that stress activates the killer cells, but long-term stress reduces the action of our killer cells. And in fact, I've got noted here that Ohio State University has been working with what is called the ATF3 master switch gene, and they know that in the presence of stress, that the ATF master switch is turned on and is a crucial link to cancer. Stress and cancer go hand in hand. It is important that we take the time to learn how to manage stress. What can we do that makes a difference? You can see here all the lymph nodes. We need to be looking at how we can make a difference to our central nervous system, proper eating, and our lymphatics. Joseph Mercola, 80% said that 80% of the immune system is in the digestive tract, and it's the fight or flight system that shuts down when we are in that state of stress, because all the sugar is being shunted so that we can react to stress. That's what our body is meant to do, to protect us. But we also know that it is digestion that is affected the most. And let's look at why when we are looking at chronic stress, we're seeing more and more people with irritable bowel syndrome, gastric reflux, constipation, major issues that we ourselves can influence and make a difference that'll affect not only our immune system, but our whole digestive and our own uptake of good nutrients. And we're talking right down to the cellular level. So how can we manage stress? And I actually have a whole section on just managing stress techniques, relaxation, dancing, doing things that you enjoy. We don't have to go on expensive vacation. A vacation can be a simple walk in nature, taking time to rest, doing hypnosis, biofeedback, massage, Reiki. For the first time, maybe taking the time to look at your spiritual well-being and how that is manifesting in your own self and in how you are managing that along your cancer journey. Managing stress, managing our systems holistically. This is what we do as cancer coaches. We take the time to help you understand how stress impacts your life. And this is where we always need to look at why on the psychological terrain, what can we do to make a difference? Because I honestly believe, as you see my little avatar here, 1/3 of surviving cancer is our medical treatment. The second is adopting healthy lifestyle changes that we have to make: diet, exercise, de-stressing. And more than anything else, it's personifying the attitudes that are in this poster. It's about a positive mental attitude across the board, because health does not come from medicine. It comes from peace of mind, peace of heart. It's our soul. It's our families. It comes from love. It comes from laughter and activating those happy hormones and getting control in your life. Maybe even learning to say no. Whatever it is, these are the things that you take into a whole and make personal change. And this is what we do as cancer coaches. Try to make that difference. Help you to understand how physiology is impacting your life, impacting everything that's happening for you. And we hopefully will help you along that journey, making a change and helping you adapt successfully to health and wellness.
Thank you so much, Catherine. Oh, we got some more people. Hi, Trinice. Yeah. Great stuff. I love that 80% of cancer healing is in our control. That was a very, very key point. And I think you've said it before that nobody has cancer from a lack of chemotherapy. Somebody said that. Maybe it was Maya. Maybe it was you. But I love that statement. But 80% is in our control through taking care of our emotional lives, which is it's not surprising to me because I've heard it before, but never a percentage. So I thought that was very interesting. We've even been challenged on the fact that we say there's actually people that have a cancer-prone personality. They're very negative people, and of course people that are highly stressed and so yeah, we've been challenged on that, but I think you made a very good medical point or physiological point to how that is actually true. It's not just what we're saying; it actually affects your body. The other thing that I thought was really interesting was the long-term stress inhibits our killer cells, and that's the macrophages, and that's an interesting study.
Yes, it is.
Yeah. So people with long-term stress, they're actually hurting their immune system.
Yeah.
They don't even realize that. And the lymph nodes, I remember somebody wrote an article for one time about the rebounder. You ever hear of that? The rebounder. It's like a mini trampoline, and it has almost like a walker type bar system, and you hold on to, and it's all attached, and you can hold on to that, and you can bounce up and down, and that actually gets the lymph nodes working, because a lot of people are too sedentary, and if they have inactive lymph nodes, it's a great thing to do. That's not very hard to do. There's no impact, and it's a great way to get the lymph nodes going. And 80% of our immune system is in our gut. Imagine that, right?
Imagine.
These are all medical studies that are out there for people to see and explore, but unfortunately, without a coach, they really don't know how to separate the wheat from the chaff. Does that make sense? Like there's so much information now that people don't know what's real and what's not real. There's one report and then there's a conflicting report. It depends on who paid for the report. It depends on what they're selling because of the report. But there's a lot of good reports out there, and they're not all from America. They're from all around the world. People are discovering things all around the world, and it's crucial. And unfortunately, in America, I don't know how it is in Canada, but most American doctors will not look at foreign reports. They don't know why. They won't, you could bring it to them, and they just dismiss it. But anyway, thank you so much for bringing up those great points. I know you brought up a lot more than that, but those are the ones that stood out to me really quick, and I wanted to jot them down and bring them back up. So we can open this up for discussion. We have mostly coaches on tonight, or all coaches on tonight, so feel free to talk and add or whatever. We have,
just so they know that this presentation is actually about 20 slides long, and I kept it really short for us.
Yeah.
Because I've got one that I can actually talk for 2 hours on.
Yeah.
So I really shrunk her down.
I did the same. Yeah, I did the same thing last week.
Yeah, because I can go on and on for hours on this. But most certainly, when it comes to immunology, I think it's the one thing that they're not stressing when they're teaching, when people come into the cancer clinics, that they're so concentrated on getting the chemo and the radiation and through the surgery and everything happening, that they're not really taking the time to do a health teaching anymore and taking that time to help people understand the changes, adaptive changes they can start now.
I think the message that the doctor delivers to a patient when they just diagnosed with cancer is like, it needs to be done right now. You don't have more time to think about it. It's like an urgency. And the patients not having the knowledge that a month is not going to destroy them. If they take off a month and do their research, or even a couple of weeks, that's not going to do a lot of changes. But it might change their mind and approaching the way they're going to approach their the treatment. I think that's the biggest message. I just remember from myself, from both cancers, when I went there, you don't have a time. We have to do it right now. And they would schedule the surgery within a couple of days, and then right after the chemotherapy and all of those things. And people, because of the fear, they jump into the agreement with the doctor and just go and do their treatment. So the message, I always say, back it up, step a step, a one step back, take a couple of weeks, think about it, do your research, and then go the way you feel comfortable approaching, the things. At the moment, it's not all in doctor's hand. The majority job is you have to do your healing process, not the doctors. You have to understand your body has to feel that. Your mental, your emotional stage, your diet, it's all your work. It's not the doctor's work. But the misguidance is the way as a patients we expect someone else to take care of us, not us taking care of us. That was the beginning, when the very first time when I had the cancer, that was my assumption that the doctor would do everything for me, not me. But then sadly, down the road, after having chemotherapy, radiation, mastectomy, and then down the road I learned I wasn't supposed to have a mastectomy, I wasn't supposed to have a chemotherapy, and I wasn't supposed to have a radiation. And who would I blame? Only myself, because I didn't back it up. I didn't listen to myself. I didn't do the researches. But it affected my life,
Mia, across the continuum of care, it has to start somewhere in the healthcare system where we start utilizing complementary care from stage one.
Yeah.
Through to going home and then going on that healing journey and implementing changes that can be done. But people need to understand they can do it now. And my biggest frustration that I see out there right now is that if you have cancer in your family, why are you not proactively looking at starting right away? Because we need to be looking at being preventative-based care from the very beginning.
Mm-hmm.
Always be incorporating change in your life to help prevent cancer, and then if you have cancer, to prevent, hopefully, cancer recurrence.
Yeah.
We need to be looking at taking the time to, across that continuum of care, to activate change, to be participatory in our change. And how can we do that when you don't have the knowledge base? I'm a registered nurse. Intensive care. I know nothing about breasts. So when I got the big C, I should not have been surprised because my mother died of cancer. All her sisters died of cancer.
Right.
Your daughters are dying of cancer.
Mm-hmm.
And yet, the last thing I did was take care of myself. Learn to say no. Learn to help myself. This is where we need to educate ourselves so that we can advocate for our care.
Right. Yeah.
Maya brought up a great point about being rushed in by the doctors. It's mom, she had breast cancer. And basically the message is, do what we say or you're going to die. Well, yeah, they're right, maybe, if you let things go on long enough. But from what I understand, unless you have a very aggressive form of cancer,
right,
breast cancers take up to 7 years for it to manifest to a size that the most sensitive mammogram can even pick it up.
Mm-hmm.
I mean,
Yeah.
That 7 years to get to a size to even be seen. So you have time. Unless it's aggressive or metastasizing, you actually have a little bit of time to step back. But the problem is that we're kind of a secret. Holistic cancer coaches are a bit of a secret, and it's not a widely known message that you could be not only an advocate but a partner in your healing. That you can actually do something for yourself. And a big point that Catherine brought up was there's the fact that, okay, you got it, you now have progressed past it, but how do you prevent recurrence? Because that's a huge fear, and again, that the fear is what will produce these bad hormones again.
Mm-hmm.
Right? You're again in a state of not healing when you're in fear. Thing you're in is that cancer coming back. So with the guidance of cancer coaches, what you can do to be proactive to prevent recurrence and prevent it in the first place, but at least prevent recurrence now that you've been through it. Now it is to get it again. So my mom, she lived past her 5 years. She lived to year 6 or 7. So on the books, she's a breast cancer survivor. And she didn't die of breast cancer. She died of a different type of cancer. And I have a feeling that manifested itself in the treatment, that she never changed her lifestyle or habits.
Yeah.
She did
The thing.
She decided to live life a little bit more, but she didn't change her lifestyle.
Yeah. People don't understand how much stress does to their overall health. They don't even realize that when the person is under constant stress, that means certain genes get activated, certain hormones get activated. So the hormones that usually we always have something to block in our body. The way our body works is so intelligent, knows how to bring down certain things, how to block the stuff. But when the person is under constant stress, those genes gets activated. And if one of the genes are activated and the others are dormant, because person doesn't know how to get out of that stress, to make other genes to work and to kind of balance the body, then of course there's more problem with hormones, more problem with immunity, more problem with things. And that's what people, and that not realizing the first thing that they have to work is their stress and mindset. But what brings the stress? Stress comes from the fear, from unknownness, uncertainty. Those are the things that causes so much stress in people. And they are confusion. They don't know, because that's what I experienced. Confusion, not knowing what to do, where to go, who to talk to, where to get the information, because there wasn't a question that my doctor answered. No question that I had questions to ask the doctors, but no question was answered ever. The only answer I got from the doctor, it was a diet is not going to work for me, because the cancer was too advanced already. It was a stage 4, it metastasized. And the second one was, it's genetics. That's it. Those are the things that she answered. But there's so much I opened up after I started doing my own research. A lot of misguidance, a lot. And the shame, it's such a big shame, I would say, to put on the system in the medical field, when they prohibit for people to talk about cancer, to talk about cancer prevention. You cannot say or write anything about cancer prevention. You cannot talk about cancer healing. If you say cancer healing, you know, it's like outside the, you know, we cannot even talk about it on cancer healing, right? If we're like, I don't know, like that's what I was told by the company. I was trying to get the job. Not job, I mean, like I was offered the job, but then they told me, like, we cannot talk about cancer prevention. We cannot talk about that. We cannot do that. I'm like, okay, you know.
It's actually illegal for us to say cure. And
cure, yeah, it's illegal for us to say cure.
Yeah, we actually never say it because we don't actually cure people of anything. What we do is help them get their bodies into the best states that their bodies can actually heal themselves.
Right.
We're optimizing health. We're not curing anything. We're letting their bodies do that.
Exactly. Exactly.
They do it, and they can't do it either. So they say they can say cure, but that's only because they have legal muscle.
Yeah. Yeah, a piece of paper that they could talk about. Yeah, I know.
It is a folly of the system, and the worst part is that it's not like a public awareness. There's not a public awareness of all of this. So my happy dream with BeatCancer would be that we become a big enough force for cancer education through the coaches that from a ground up level, not from a doctor coming down, but us helping families and then other people noticing what happened and other people adopting change and grow at this grassroots level, that we cause a paradigm shift in thinking, just like smoking, because smoking at one time was healthy for us. We all know that, right? Doctors promoted it. They were on commercials, you know, and
yeah.
my pediatrician had a big ashtray on his table. I remember as a kid, you know. But then there was a paradigm shift in the public awareness, and all of a sudden it became different. Mm-hmm. So I'm hoping that would be my happy dream, that there becomes a public awareness of the way that we can affect change.
But Carl, I also think a lot of that of public awareness is about helping them understand that they can choose to react to stress appropriately.
Mm-hmm.
Okay?
Yeah.
That's hard in anybody's everyday life.
Adopting lifestyle changes, you know, exercise, improving their sleep, practicing relaxation techniques, all of these different things that they can do, just fostering healthy friendships and you know, humor and everything they need can be based and found not only in their communities, but by looking for help with cancer support via cancer coaching. And yet they people are often not willing to take the time to help themselves. They're reading and going to sources that maybe not are reliable. And so you need to be looking at a positive mindset and being proactive and saying, I'm going to do something for me, and I'm going to create change, and I'm going to educate myself, and I'm going to help myself. And the easiest way to help is to find a cancer coach that you can relate to. And I think this is the beauty of the program we have here, Carl, so people can come in and take a look and see, take a look at some of the cancer coaches that we have on our system and say, hey, I kind of see eye to eye with this person, and then tap into their help, and hopefully they're able to make a difference in their lives, because it's not just a matter of hope. It's about being proactive enough and loving yourself enough to want to make a change and to want to survive, to want to thrive, to find a reason to love yourself and to go on in life. Mm-hmm. These are the things that will make a change. These are the things that lower your stress, because as you start to make change and decreasing your stress and implementing all those relaxation techniques and things that will help you manage stress appropriately, these are the things that will make the difference in your wellness and in your health. This is the sunshine that you see. Mm-hmm. For a future that'll make a difference in your lives. But it
is
has
always
to be appropriately managed.
Yeah, it is all a choice too. I mean, a lot of people react to things the way that their parents reacted to things, or they go the polar opposite, one or the other. I mean, you get that a lot. So if you're the type of person that gets mad quickly, or your first response to a crisis is anger, you got to make that choice to actually become to react in a different way. It's not easy all the time, but kids are a great mirror. My kids are great for me and the way I deal with things, because when they're little and you react in an angry way, man, they're just like an immediate response on the kid, and you see, oh wow, that was all right. So you have to make that conscious choice that I'm not going to behave in that way. And for that reason, they were really good for me, right?
Yeah.
Aggressive or whatever you want to put that. But so the point is, people have to make that choice. They have to know they have to have a choice, and then they have to make it.
Yeah.
I think that's part of what's missing in the whole system is, like, I talk with my clients about the medical side of the house is going to handle the medical stuff, but who's handling the human side of it? Like, that's what we're here for as coaches, is to handle the human piece. And people don't know how to change their behaviors if they don't know that their behaviors are inappropriate or excessive, or if their responses are abnormal or not in their best interest. Another piece that I wanted to just mention in terms of the whole stress thing is we saw in the article in our training from Dr. Perlman about that rejecting the prognosis piece. When you dump in somebody's lap, well, you might make it to a year if you're lucky, and maybe you'll have 6 months, and if you make it to a year, you might make it to 3. And I talk with people who are saying that they feel hopeless because the doctors just told them they're going to die. I was talking to a lady today. She said, my doctor told her kids, her adult kids, in a meeting, your mom's not going to be here in 6 months. These are things that we can do. There are things that we can do. Just your mom's not going to be here in 6 months. And so that there is a hopelessness in the system that we need to fill that gap by teaching people strategies and giving them the tools. Nutrition, I think, is a huge foundation piece, but being able to talk them through that. You know what? You are not your diagnosis. You don't have to accept your prognosis. I didn't even get my prognosis. I told them I wanted no part of it, that every day was 100% chance. Don't tell me that I'm going to maybe make it. I'm going to tell you that I am going to make it. And that's what we need to be teaching people. And that you can thrive, like Catharine was saying, and you can live your best life right now. Because worrying about what's coming is creating that stress in the body that just continues that cycle, that reaction in the body. The past exists back there. We can't change it. And the future, we can't control the future. We don't know what's coming yet. We got to just nurture this body that we're living in right now and take all the tools that Beat Cancer is teaching us and that we can learn through educating each other, and give those to the people that are told, you've got 6 months, there's nothing we can do, eat whatever you want, do whatever. All of those things they're contrary to human nature, to survival. Our instinct is to dig in and do our best. That's in our reptilian brain, that's what our ancestors did, find food, shelter, and safety.
I agree with Catharine. I totally agree with Catharine, because when I was thinking, like, based on what the doctors are giving me, 15% of survival rate past 5 years, I'm like, based on what? Is it based on information and based on statistics, right? So why that has to be my life and my reality? Based on what? So if they're assuming that's that I have to expect, so why don't I flip that assumption and make it positive? because they don't exist. At the present time, they don't exist. So I kind of flipped that assumption, and instead of looking into the negative part of it, oh, might make it, might not make it, so I just flipped that, and I just said, this is fake, so let that fake be a more positive fake. You know what I'm saying? Yeah. So, and I just flipped it up, and I just stopped looking into the future with like a brightness and happiness and all of those things, and then as time passed by, I just stopped believing in it. Like, it's just my subconscious, my body stopped picking up that happiness and everything, and the fear dropped, and I a completely different outcome.
What we have to remember is statistics are based on other people's numbers.
Exactly.
Are from a line of people, and that there's the outliers. I was stage 4 colon cancer. I'm an outlier. I'm
yeah.
Of people. I'm at 7.5, almost 8 years now. And then there's people that sadly they don't make it, and then they just cut us in the middle on the average and say, here's the numbers around that. But there are people who are outliers, and statistics couldn't determine who we are, because if you lined up all those people, if you put 5 people with breast cancer all beside each other, everybody's physical terrain and their emotional terrain and their upbringing coming into cancer is entirely different. Cancer is an individual disease, but it's not treated like an individual disease. It's a program, and it's not. Because everything from the time you were born, how you were raised, where you lived, levels of toxicity in your environment, in your physical terrain, impacts how your body's going to respond to everything.
Absolutely. Yeah. But you know what? A positive mental attitude is critical in everything you do.
Yeah.
It is your attitude that makes the change. And that is why it is important to reframe anything anyone says. Take it with a grain of salt and reframe, make things positive, and try to find a method. So, no matter what you experience, turn it around. How can you use it? How can you make it to your advantage, take it to your advantage, or take advantage of a negative and turn it into a positive? And ignore this and keep going. Because you have to be able to control and feel that what you're doing and what you're learning and how you're advocating for your care is going to make a difference. You have to feel comfortable and positive that that is what you want to do. It's your choice, not their choice. It's your choice to make a difference, and you have to choose to make a difference in your life. And it's that positive mental attitude that, to me, is like reframing, and that's what lowers your stress, because you feel good about the choices you've made. That in itself is a foundation for where you're going to go, and a springboard to help you go forward.
Yeah.
Well, the great thing about the future is you get to start today. Start right now.
Right this moment. Every second is a new future, basically, right at the moment. And the moment people will understand, they are the one who feel their body. They are the one who feel everything, what their body is about, all the pain, all the discomfort, all the happiness, all everything. It's not for someone else to come and interfere and deal with your body. It's your body. You're in charge of it. It's given to you, and you're in charge of your body to be happy and healthy. And that's what, that was a kind of, for me, once I understood that was like, okay, that's it, done. I'm the one who has to deal with it. I'm the one who's going to take care of it. No one is going to do it. No one.
And a great part of your story, Maya, is, how you had to cut people out of your life that were negative, that were bringing you down.
Oh, yes, absolutely.
Absolutely.
It might be eliminating people that make you stressed.
Yeah. You have to step back. It doesn't mean you don't love them. Doesn't mean you're it's a moment of your life. You have to step back for yourself. You have to step back to understand. So, and that experience had taught me, even being in a group of negative people, I don't connect with them, not emotionally, in no way. I just would stand there and listen, and I know it's temporary for me that I'm there, and I would just listen to it. And I I will leave the group and I would just forget about it, whatever they said, whatever they told. So that's why, like, past couple of years never affected me in any ways, because I didn't allow it to affect me. If I would have allowed, it would have affected me. You know, whatever happened in around with the world and everything, I didn't allow it to affect me in any ways.
Linda, did you want to add
You change the people around you, change the people around you.
Yeah, it does. It does.
And it's the ultimate form of self-love, I think, to be able to see what you need. And it's not selfish to move people to the side or to take a bath or to be alone or any self-care practices, anything that you need, because truly you're working on living, and you can't find your best version of yourself and live your best life if there's this umbrella of negativity or doubt, even the people that tell you you shouldn't do that and can't do that and don't hold you in at the highest level of possibility.
Mm-hmm. Yeah.
And love yourself.
There's also the type of person that's in the cancer-prone personality is the caregiver, the one that does everything for everybody else and puts themselves last, and everybody's nodding their head because
exactly.
Mm-hmm.
Yeah.
That's why it has to be what you want.
Yeah.
Yeah.
The first time you make decisions for yourself, you'll learn to say no. You just do what is right for you.
Yeah.
Right.
I think that's where people find it hard to step into coaching too, is because now they're actually advocating for themselves. They're taking their situation and doing something about it, caring for themselves for maybe the first time ever. But coaching, I truly believe, I wish that I had it, is the best tool that we can offer to people in a loving and caring way, so that they can learn that they have to come first. They have to come first in this case. And that doesn't mean that they don't love their family and their friends, but this is truly about taking control of your life. And coaching is just such a safe space and a great way for people to recognize that they are important and the most important thing in the moment.
Yeah.
Yes. Yeah. I totally agree with that.